the years, MS Teamworks has shared perspectives on MS from all members of the MS team. And although 2020 brought unexpected challenges, we were determined that a pandemic and social distancing would not stop us from sharing new and meaningful perspectives. The setting was different, but the message is the same. I have MS. I have a team. I have a future.
Hi, my name is Megan Weigel. I'm a doctor of nursing practice, and I have my own integrative medicine practice in Jacksonville, Florida called First Coast Integrative Medicine, where I specialize in the care of people living with multiple sclerosis and other neurological disorders and symptoms. I'm an MS certified nurse, and I've spent most of my 20-year career as a nurse practitioner in the field of multiple sclerosis. Many people ask what the difference is between mindfulness and meditation because, frankly, a lot of the things that we read about managing stress these days kind of use the terms synonymously. So let me explain the difference to you. Mindfulness is the capacity and the act of being 100% present where you are in that moment. So for example, if I am seeing a patient or if I'm playing with my son, I'm 100% present in that moment instead of thinking about the next thing on my schedule at work or all the chores that I need to do in the house. And therefore I can really give myself and the person I'm with the attention that they need to get the best outcome. Meditation is actually an act, and it's an act of tuning down your mind and your nervous system so that you can empty your mind. Both mindfulness and meditation have similar goals, and those goals are to help manage stress better, to help drive down anxiety, and to improve a sense of well-being. But meditation is more of a specific practice. For example, you would set up for meditation. You would sit in a specific way with a specific posture and maybe follow a certain breathing exercise or even listen to a guided meditation with the purpose of emptying your mind, and as thoughts came into your mind, letting go of those thoughts. Whereas mindfulness is the act of being 100% present wherever you are, and it can be done just like that wherever you are. We are just starting to hear about completed studies in mindfulness and meditation and multiple sclerosis. And what we see from the results of those small studies is that there's an improvement in anxiety and pain in people living with multiple sclerosis who practice mindfulness or meditation. In general, what we know from studies about mindfulness is that it truly does increase the quality of mental health. It does decrease anxiety. It can decrease pain. And from studies regarding meditation specifically, we know that there are improvements in cardiometabolic risk factors like blood pressure, diabetes, and then again, similar things like anxiety, pain, and sleep. So we need to grow the body of literature in mindfulness and multiple sclerosis, but I suspect we would see similar things as we do in the general population. One of the ways that I like to incorporate mindfulness into my daily work life is to identify a behavior or an act that is repetitive, that I can grab onto and change into a mindfulness moment. So right now, one of those mindfulness moments that seems to be happening quite frequently is using hand sanitizer. It used to be washing our hands in between patients, but I think many of us are finding that we're using hand sanitizer more often than we would be washing our hands. In any case, you can use that moment where you're using your hand sanitizer to take a couple deep breaths and center yourself into the present moment. Similarly, if you are still using charts, paper charts, like the old-fashioned way when we used to grab a chart from a door before we would walk in, if you still do that, you can use that moment. Or when you open a new patient chart on a computer, you can use that moment again to just reflexively recenter yourself and focus on that moment with that person. And it will become routine to you. It will become less of a distraction and more of something that you find yourself wanting to do because of how it feels in your body. Not being mindful can impact people living with multiple sclerosis in many negative ways. And I think the most important one that people tell me about is anxiety. So when you let your mind run away from you because you are dealing with a chronic neurological condition that you don't know that you have control over, or that you don't know that you can predict, you tend to lose the capacity for mindfulness. Your mind runs away from you, and it's like a ball of string that keeps getting bigger and bigger, and it creates a flurry of anxiety in the brain. This in turn can cause problems with sleep. It can cause problems with blood pressure. It can cause problems with pain. So really trying to learn a practice of mindfulness can improve the quality of life of a person living with MS. The unpredictability of living with MS may make it challenging to live in the moment. People living with MS are dealing with so many different decisions, really on a minute-to-minute, hour-to-hour, day-to-day basis. And those decisions may be, do I feel well enough to get up today? Do I feel well enough to go to work today? How much medication will I need to take today to manage my symptoms? Am I faced with a disease-modifying therapy change? Or how do I need to alter my schedule so I can go to the lab or get a test done or see a different specialist? So it really can make it difficult when your mind is already busy with all of these things. Oh, and I forgot to mention, you might have some issues with memory and with cognition. And so if you say to yourself, well, gee, I might want to empty my mind, then you might worry that you are going to fill it back up with the wrong stuff or leave something out that you really needed to remember. So those are the biggest challenges that I can think about when it comes to living with MS and being mindful. On the back end of the coin, being mindful can actually improve that impulse to again, let that mind run out of control and disrupt your sense of calm. There are so many different techniques that can be used to teach mindfulness. One thing that I teach people to do is similar to the things that I would advise a clinician to do, to pick something out of your day that you do over and over again, or that you do every day, and use it as a reminder to be mindful. So maybe it's a moment when you get in your car before you go to start your day, or even when you get home. Perhaps it's a breathing exercise. And the breathing exercise that I like to teach, because it's so easy to remember, is called the 4-7-8 breath. And what you do is you inhale through your nose, a deep breath to a count of 4. You hold the breath for a count of 7, and then you exhale through your mouth to a count of 8. And for busy people who say, I just can't sit still to meditate, I'm not sure how to be mindful, I teach them that breath, the 4-7-8 breath, because it takes 19 seconds. It's also a breath that very quickly calms down the sympathetic nervous system, or that fight or flight mechanism. And I have many clients that I work with use this while they're waiting for their MRIs, or while they're waiting to be seen by their healthcare provider to get news, because it helps them create a sense of calm in their body. I have a nonprofit organization called OMS Yoga, and we teach free yoga classes to people living with multiple sclerosis. When people ask me if I have a success story about mindfulness and meditation, I always refer back to the OMS yogis in our classes. They tell us that beyond the physical benefits that they've received from yoga, one of the greatest benefits that they've received from that practice, which is a moving meditation and truly a place of mindfulness, is relief of anxiety. I think that that speaks for itself, and was something that we didn't think about when we started the classes. We were really focused on improving balance and helping people to feel empowered in their strength, and helping people to feel courageous. And at the end of the day, they're coming out with markedly less anxiety. So that's my greatest success story. My main message about mindfulness and meditation is that people living with MS can use it as a tool to feel empowered and in control of what's happening in their bodies. People taking care of people living with MS, whether it's a healthcare provider or a support partner, can use mindfulness and meditation in the same way, because those folks are also dealing with unpredictability in supporting their loved ones or their clients. So MS is an unpredictable disease, and people often say they fear the lack of control. And if you begin a practice of mindfulness, or a practice of breathing, or a practice of meditation, it's hard not to notice the calm that happens in your body. It's hard not to notice that when your heart is beating fast, by taking some slow and deep breaths, you drive your heart rate down. It's hard not to notice the sense of peace or the sense of calm that you feel when you empty your mind or when you sit quietly. So I really love for people to experience the empowerment of mindfulness and meditation, and creating a calm and peaceful space in their minds and their bodies.